Good afternoon, everyone, and welcome to the Urban Institute. Thank you for joining today's virtual event, The True Cost of Economic Security. What does it take to thrive in the US today? I'm Mary Cunningham. I'm Senior Vice President for Research and Programs here at Urban, and I am very excited to kick off today's event. I'm going to start with some housekeeping. This event is being recorded, and the recording will be posted online afterward. Speaker biographies and related materials are available online. All participants are muted, but you can type your questions or comments into the Q&A box at any time during the program. If you'd like to engage with us online, you can do so by using hashtag #LiveAtUrban. And at the end of the event, please take 1 to 2 minutes to complete the survey. Your feedback is really valuable and it helps us plan future events. So now on to the reason why we're here. What do the data tell us about economic security in the US? About 52% of US residents report that at best, they are just making ends meet. Only 33% report they live comfortably. But the measures of economic insecurity we normally think of, like the poverty rate, only capture acute need, and they don't show us chronic hardship. The millions of people who struggle to pay the bills and save for the future, people who are economically insecure and who are not poised or set up to thrive. To better understand these family circumstances, their resources, and what it takes to fully participate in today's society and economy, the Urban Institute developed a true cost of economic security measure. Today, we'll hear about how Urban built this measure and what we found. And then we'll have a discussion about how policymakers can use it as they consider policies, practices, and programs to better support American families. So I'd like to welcome and hand it over to Jennifer Jones-Austin, the Chief Executive Officer and Executive Director of the Federation for Protestant Welfare Agencies and the co-chair of the National True Cost of Living Coalition. Welcome to the Urban Institute, Jennifer.
Thank you. Thank you so much. And good afternoon to everyone. On behalf of the National True Cost of Living Coalition, I want to thank the Urban Institute for today's presentation, centering on the first ever national measure of the true cost of economic security. I also want to thank the Urban Institute for once again leading in research and critical analysis on the issues and challenges facing people and communities throughout the United States, and for developing a measure that provides key data that going forward can and should inform policymaking on issues of financial security, opportunity, and dignity for all. In 2023, David Jones, CEO of the Community Service Society, and I decided to convene a national coalition to call for the creation of a new national cost of living measure that is based in economic security. The coalition, comprised of policy experts, practitioners, economists, and advocates, commissioned the Urban Institute to develop the measure because we know from on-the-ground engagement with families classified as low income and middle income that their ability to get by, get ahead, and stay ahead is growing more and more difficult. We know from our work that more and more there are people who struggle financially but are not seen because existing measures of individual and family financial stability, such as the official poverty measure, center on subsistence, not security and thriving. And we know from our work that traditional economic indicators often do not directly align with lived experience. In New York City in 2022, racial justice and equity were on the ballot, and voters were asked to decide if the city of New York should annually calculate the true cost of living. Not surprisingly, with more and more New Yorkers feeling the pinch of covering daily living costs and trying to save for a rainy day and for their futures, the measure passed. Overwhelmingly, 81% of the people who voted yes. People from all over New York City were demanding that the city look more closely at their financial struggles and use relevant and related data to inform policy that would materially impact their circumstances. Like many New Yorkers, people across the nation are feeling the pinch. A poll conducted by the National True Cost of Living Coalition found that 59% of Americans, including those considered to be middle class with incomes between 200 and 500% of poverty, are struggling, and that many, while able to meet their daily needs, are worried about tomorrow. Many have less than $500 in savings. The coalition determined that America needs a way of seeing them, that federal, state, and local policymakers must see them and their financial challenges. With the backing of the Ford Foundation, the Kellogg Foundation, the Stardust Fund, Trinity Wall Street, and the New York Women's Foundation, the coalition funded the Urban Institute's critical and timely body of work, resulting in the first ever National True Cost of Economic Security measure. And now the coalition will be moving to ensure the measure is widely disseminated and utilized. The coalition greatly appreciates the guidance provided by members of both the Coalition Steering Committee and inaugural coalition members who are listed here, that are listed here. Again, I want to thank the Urban Institute and all who are here today for today's conversation. We look forward to the presentation of the measure and the panel to follow, and to the impact that this measure is certain to have as we all strive to achieve a more equitable and just society. Greg, this moment's yours.
Thank you, Jennifer. Uh, Developing a measure of the true cost of economic security was a big effort, and we are grateful to our funders, the Federation of Protestant Welfare Agencies and the Community Service Society of New York. And I want to acknowledge my colleagues on the research team, Linda Gennarelli, Ilhan Derry, and Margaret Todd, as well as our programming team, Joyce Morton, Paul Johnson, and our lived experience team, Selena Barrios Milner, Elsa Falkenberger, and Leandra Lacey. So when we were developing a true cost of economic security measure, we wanted to capture all the costs a family needs to meet in order to be economically secure, financially resilient, and poised to thrive. We also wanted to make sure that we captured that costs differ depending on where you live. Some places are just more expensive than others. And we also know that families of different types have different costs. Elderly people over age 65 have some higher costs. Children have some higher costs. Bigger families have more costs than smaller families. So we wanted those costs to vary by place and family type. In addition to capturing costs, we also wanted to do as good a job as we possibly could capturing all the resources that were available to families to meet the costs, including saving for the future. And we wanted to build this measure using high quality publicly available data sources so that we could do it again, repeat it in the future, see how type of progress we were making. And finally, setting what are the costs that you need. There's a subjective element to it, but we really wanted to ground our measure in the experiences of U.S. families today. So with this measure, we can use it to see how many people are struggling economically, see how that varies by people of different demographic groups and living in different locations. Understand the reasons why they're struggling. Are there certain costs that are prohibitively high for certain families in certain places? To what extent are resources a challenge as opposed to costs? And once we sort of see who is struggling and why they're struggling, that should help policymakers at federal, state, and local levels identify policies, programs, practices that can support and empower families to help them meet the true cost of economic security. Here are our top line findings. Overall, we find that 52% of people in the US are economically insecure and not poised to thrive. Now, 9% of people are close. They're within 90% of the true cost of economic security threshold. That means they're pretty much meeting all the expenses we think they need to meet. What they're not doing is saving for the future, which puts them in a precarious position. They don't have precautionary savings. They're not saving for the kids' education. They're not saving for retirement. Kids are the most disadvantaged age group. 61% of children are in families with resources below the true cost of economic security threshold. And that's a higher proportion than what we find for working age and older adults. And then across the country, we find that people living in the non-metro west region of the country, so in the west, but not in major cities, are the most likely to be economically insecure at 59%. People in the metro Midwest are the least likely to be insecure, i.e., a higher proportion of them are poised to thrive. So how did we do this? We began by doing a comprehensive review of the costs families need to meet to have a solid standard of living. We set thresholds that varied by place and by family type. We then went and looked at all the resources that families had to meet those costs. And we looked at the true cost of economic security rates for people in different circumstances. So how many people, what share of people have more resources than we think they need? How many are secure? The data are all harmonized to represent 2022. And it is a point in time measure that we are looking at. To build the true cost of economic security measure, we built on a foundation of considerable past research, from poverty measurement to self-sufficiency measures. We looked at what these other efforts did, what costs they consider, how they captured them, picked and choose and innovated and added to build our measure. So let's begin by breaking down all the costs we think families need to meet and what thresholds we set. So everyone needs a place to live. So housing is an important cost. We set the cost of housing using fair market rents from HUD. Fair market rents include the cost of utilities. The cost of a place to live also varies by the number of bedrooms you have. And we decided that children who are under the age of 13 who are of the same sex, two can share a bedroom. If they are of different sexes, each one needs their own bedroom. And once you hit teenagers, they all need their own bedrooms. And those are the costs that are reflected in our housing costs. In addition to housing, people need to eat. For food costs, we use the low cost food plan from the USDA as our threshold. The official poverty line uses the thrifty food plan, which is a slightly lower cost food plan. We decided we wanted to be higher than poverty, so we used the low cost food plan, and we did some regional adjustments using the MAP meal gap data. People need healthcare. It's a major expense. So we look at healthcare in two components: health insurance and out-of-pocket expenditures. For your insurance cost, we set the cost you have to pay for health insurance at the second lowest cost silver plan in an ACA marketplace. For out-of-pocket costs, we looked at what people reported paying for non-premium expenditures, things like over-the-counter meds, in the current population survey, and used that to assign costs to our households. Families with young children need childcare. So we set the childcare cost at the median cost of center-based care for children under the age of 13, and we sourced that data from DOL's national database of childcare prices. People need to get to and from work, to and from school, to and from the grocery store, so there are transportation costs. And so for transportation costs, we use data from the Housing and Transportation Affordability Index, and setting out what the average spending is for families with income at 80% of average median income in their location. And these transportation costs capture public transit as well as the cost of acquiring and maintaining and using a vehicle. Technology, we didn't have a way to comfortably look at regional variation. So for broadband access, we figured everyone needed broadband access at a cost of $60 a month. For cell phones, we assumed that the cost of a cell phone was $65 a month for the first cell phone, and that every family member over the age of 13 needed to have their own cell phone, with costs diminishing the more cell phones you have for economies of scale and family plans and things like that. Taxes. You make money, you owe money, you have to pay taxes. So we have the ability to calculate what taxes are for each family, both federal, state, and payroll taxes. And on the cost side, we're just looking at what you owe, which is not the net, just what you owe in taxes. Tax credits we could put back in on the resource side. A lot of families carry debt, and we couldn't capture all debt that people have, but we did want to focus in on student debt because we had information on student debt by county and how many people are paying off student debt in each county, as well as what the average payment is. So using that information, we were able to assign debt to certain families in certain places based on whether we thought they had a student debt, and we focused on families who had adults who had at least some post-secondary education, so they were acquiring education that had needed to get student debt, and that they were paying it back. They were between the ages of 19 and 45. So that's how we assign student debt. Miscellaneous expenditures that, you need other stuff. You need clothing. You need school supplies. You need books. You need cleaning supplies. We sourced that information from the Consumer Expenditure Survey. We had some regional variation and variation by family size, and so we added those costs. And finally, I mentioned savings before. Even after you've met all your costs, something can go wrong. You need some precautionary savings. You need to start thinking about saving for your kids' education. You need to start saving for your retirement. And so we set a savings target at 10% of all your other costs. And so basically what that means is if you take the financial advice that you should have 6 months of precautionary savings, in 5 years, you can build up to get your precautionary savings, and then beyond that, saving for your kids, saving for your retirement. On the resource side, we got resource information for families from the American Community Survey. And the resources that families have to meet all those costs come from their annual earnings, any self-employment income, interest, dividends, and rent, pension income, cash transfers from public programs like TANF or SSI. We counted the cash value of in-kind transfers from programs like SNAP and WIC. We were able to, we know that some of these transfer programs are underreported. People don't report that they get them. When they do, they don't report the right amount. Using our ADIS microsimulation model, we are able to ensure that all the money that's going out in these public assistance programs is assigned to people. So we adjust for those resources that are underreported. We also count child support that families received, and we also count tax credits that families receive on the resource side. Finally, we look at health insurance and childcare. If you are receiving health insurance through a government program like Medicare or through your employer, we don't get into the details of exactly how much you're getting for it. We just say, okay, check, you have health insurance, and we set the value, the resource value, exactly at the cost that we assigned on the cost side. So it's a pure wash for your insurance costs. And then for childcare, if there is a second or third or fourth adult in the family who is not working, and there is a child who would otherwise need childcare, we assume that additional adult is staying home and providing that childcare. So we say the value of that home production, what that adult is doing, is offsetting the cost of childcare. So we count that human resource as a resource. Lots of words. So let's look at putting it all together and look at the costs and resources that families have and how many don't have the resources to meet those costs. So they vary by family type. So for this slide is going to focus on families with children where there are no adults present over the age of 65. So working age adults with kids. And I'll be presenting median costs. These are the median costs for each category of spending, and then median cost total for the family. And because they're medians, each category, you can't quite add up all the categories and get to the same total. So just keep that in mind. So let's start with housing. On average, a family with adults and children, the housing cost is $18,200 a year. Layer on top of that your healthcare costs at $20,400 a year. Transportation, food costs come in at $12,800. Transportation costs come in at $15,500. Childcare costs are at $11,400. Your savings target is $12,300. The taxes you owe on average come out to $15,700. Again, that is not your next net tax bill. That's tax cost before any tax credits. And all your other expenses, all smushed together, are $18,700. The median cost overall for a family with kids, $134,800. How does that compare to resources? Well, median resources are $121,000. So the typical family has resources that fall below the true cost of economic security. And as such, we see that for people in families with adults under the age of 65 and children, 58% do not have the resources to meet the true cost of economic security. What about other family types? So looking at families with adults under age 65 and no children. So all their costs are lower. They don't have childcare costs. And the median threshold for people in these types of families is overall just under $89,000 a year. And their median resources are just over $92,000 a year. So overall, we find that 46% of people in families where the adults are under age 65 and there are no kids present, 46% of those families do not have the resources to meet their true cost of economic security. Next, turn to families where there are older adults present, adults who are age 65 or older. Overall, these families' costs are somewhat higher, especially healthcare costs are higher for those families. The overall threshold for those families, cost threshold, is about $105,000 a year. Their resources are about $109,000 a year. Remember that if you have health insurance, it offsets your health costs. So thank you, Medicare, for many of those families with people over the age of 65. And overall, the true cost of economic security rate for those families is 48%. Let's look at two specific types of families. 3-generation families where there's a kid, an adult, and an elderly adult. And then also families with children and student debt. So 3-generation families have higher costs because of their size, but they also have higher resources than adult families with kids in general. And so the economic security rate is similar to the rate for families with kids at 56%. Now let's look at families who are carrying some student debt. On average, student debt is about $2,000. Your debt payments are about $2,000 a year. All other costs are pretty much in line for those with families with kids. But it's important to note that these families that have student debt have somewhat higher resources. You went into debt to increase your education. That education paid off in higher employment and higher earnings. So overall, families with student debt and kids, their economic security rate is 48%. Let's look at how things vary from place to place. Again, let's focus on families with adults under the age of 65 and with kids. You can see that in metro areas, cities, as opposed to non-metro areas, cities and their close-in suburbs, that costs are higher in metro areas, especially housing costs. But resources are also higher in those places. So on net, there's not that much difference in economic insecurity rates in metro and non-metro areas. Looking across regions, we can see that in general, costs are higher in the Northeast and in the West, but they also tend to have higher resources in those areas. In the Midwest, costs align pretty well with resources. And again, these cost and resource numbers are the experience of families with children and adults all under age 65. You can see the rates vary for all families, not just those with kids, across the regions, from a high of 57% in the West. So 57% of folks living in the West are in families where the resources do not cover the true cost of economic security. The lowest rate is in the Midwest. 47% have resources that don't cover the cost of economic security in the Midwest. So a greater proportion of folks in the Midwest are secure as compared to the West. Just want to go over the share of people in different demographic groups whose resources fall below the true cost of economic security threshold. For kids, folks under 18, 61% live in families where resources do not cover the cost of economic security. For working age adults, 18 to 64, that's 49%. For older adults, age 65 and up, it's 47%. Looking at race and ethnicity, we see the highest rates of economic insecurity for Hispanic people and Black people, lower rates for Asian and Pacific Islanders and white people. And these differences reflect longstanding structural factors that impact where people can live, as well as their work and schooling opportunities. So keep that in mind when looking at these differences. And then also, these are averages within race and ethnic groups, and we know that there's a great deal of diverse experiences even within these broad race and ethnic categories. Finally, we wanted to sort of understand what differentiates places where lots of people are struggling from places where lots of people are thriving. And so we looked at the 100 largest counties in the US, where we have sort of the largest samples and the best data. And we looked at the 5 counties that had the most people struggling, the highest TCES rate, and the 5 places where had the most people thriving, the lowest TCES rates. And we wanted to compare their costs and their resources. And in places where lots of people are struggling, costs are a little bit higher. Some specific costs, housing costs, are a little bit higher. But overall, there isn't that great difference in the costs in places where people are struggling versus places where more people are thriving. What really differentiates the places where people are thriving from the places where people are struggling is in the resources. So in places where people are thriving, average resources, median resources for those families is people in those families is 172,000, over 172,000. In the places where people are struggling, the resources are around 100,000. That's a big gap. And that's why you see this wide range in economic security rates, from 71% of people struggling in places where people are struggling, to 32% in places where people are generally doing pretty well. Some things to keep in mind. One, our true cost of economic security measure is only for 2022. We do not know about trends. We cannot say whether things are getting better or getting worse. We do hope to replicate this going forward to keep track of how things are changing. We select specific cost thresholds to set that threshold for economic security. Opinions may reasonably vary about our precise cost thresholds, and we hope we've given you the information and the tools to understand how our assumptions may be affecting our rates. But again, we built on work of others and grounded in the lived experience of people in the US today. Finally, capturing all the resources that people have is tricky. And so we know, we know that pension income can be underreported. So we be sure we don't capture all pension income. We also know that some people own their houses and pay far less than they would need to pay if they were renting. And there's some value there that we also don't capture. All things to be aware of and to improve upon in the future. But to conclude, our key takeaways: about half the people in the US are economically insecure based on our true cost of economic security measure. That families with children are particularly vulnerable, and that in places where higher proportions of people are struggling, they don't have particularly high costs. Rather, the resources of residents are low. So going forward, bringing costs down, particularly higher cost items like housing, will help reduce families' struggles and make more areas affordable to more people. But helping to increase families' resources is a crucial element to helping people become poised to thrive. I thank you for your time, and I would like to turn this session over to my colleague, Myra Jones-Taylor, to lead a panel discussion. Thank you.
Thank you, Greg. And now if I could invite our panelists to join, and while they are signing on or while they're joining, I just want to reiterate a few housekeeping notifications that you probably heard already, but just to reiterate. First, the speaker bios are available on the event page. This session is being recorded, and all recordings will be shared after the event. And we encourage you to submit questions into the Q&A box, and I already see them filling in there, so thank you for that. Please continue to do so. We have also enabled closed captioning for accessibility, and you can adjust your settings at the bottom of the screen. So now I am going to have our panelists introduce themselves quickly, and then we're going to dive into a conversation. So I will start with Jose, Indy, and then Sadia, and then we will kick off the conversation. So Jose, please.
Thank you so much. Yes, I'm Jose Pacas. I'm the Director of Data Leadership and Investment at a foundation called the Constellation Lab in Minneapolis. Thank you for having me.
And thank you, Myra. I'm Indy Dattagupta. I'm a Doris Duke Distinguished Visiting Fellow at the McCourt School of Public Policy at Georgetown University.
Good afternoon. My name is Sadia Sherman. I'm New York City's Chief Equity Officer and Commissioner of the New York City Mayor's Office of Equity and Racial Justice.
Well, welcome to you all, and I should probably introduce myself. I am Myra Jones-Taylor, as Greg said, and I have the pleasure of being the Senior Vice President of Impact and External Affairs here at the Urban Institute. So we're going to dive in, and I'm going to start off with asking a few questions of Jose and Indy. And Jose, I know you're going to kick us off here, but we can just start. The top line finding from this work is that over half of all people in the United States are economically insecure. And I just want to hear from you, and then from you, Indy, if this surprises you at all.
Thank you. And I'll give a little more context of my bio, because I realize having a person from a foundation talking is like, what's the relationship here? But the way I'll introduce that is the answer to your question being at first was, I don't know if I'm surprised. I think I need to go look at some more data to answer that question. My background is I started working at the Census Bureau in the Poverty Statistics Branch, moved off into the Minnesota Population Center at a project called IPUMS, which houses the data that actually underline the American Community Survey data come from that in this report. And the most recently relevant to this work is I served on the panel for updating the poverty measure with Indy, in fact. So it's great to be united again. But let me get into why I didn't know how to answer the question. And partly it's because first, I get beyond the human aspect of this when I start thinking about, well, 52%, that means that outside of here, 1 in every 2 families is the better way to think about it, will be in this economically hard situation. And that's a surprising thing because you're realizing that that's every other person you see. But as a econometrician, as a poverty measurement person, I start thinking about it from a statistical perspective. So I directly went, and I'm going to drop something in the chat in a second, to the Census Bureau. And I started looking at the supplemental poverty measure. And I said, well, how close is this threshold that we're talking about, this line of economically secure, to a poverty line? And what percentage of the poverty line? And it turns out when you start looking at this, if for a family of 2 adults, 2 children, it's about $140,000 for the TCES. But for the SPM, we're talking about it's around $37,000, which gets to that point that you're all talking about. It's like that is a very low number. So that's actually about 4 times higher. The SPM is 4 times lower, the threshold, than the TCES. But there's this nice tool where you can change that level of the SPM to try to get up there. And when you set it up to 4 times the poverty threshold for SPM, you find that it's a rate of around 63%, right? So the point being that when you push that line up for the SPM, to just give you a ballpark of like, are we even hitting a mark? Are we close? The answer is like, well, maybe that actually is telling us something that is really unique about this measure, that it is capturing something that's probably a very valid measure. So the last thing I'll say about that is the thing that I keep on thinking about is how this measure fits in the context of all the other measures. Because this TCES is extremely exciting. So I should have started with congratulations. This is a very exciting moment. It's a lot of hard work to develop a measure. And the way I think about it is now part of an ecosystem of many measures. None of them, some of them maybe not as great as others, but they all tell us a different story. Even the OPM tells us something really important. The TCES tells us something else. And so thinking about those in context is really where I'm heading at with this. Is like, I don't know the answer to the question of like, am I surprised? Well, now I say, not really, but this is really useful. The real question I have is, what else can we learn about the underlying distributions of, let's call it not poverty, it's economic security, given that we have this measure? What is unique about this, and what does it tell us about the realities of economic security in the US?
Thank you. Indy, I know you have thoughts on this as well, so have at it. Indy, you're muted.
Sorry about that. Double mute.
okay.
Fear of the hot mic. So first of all, I think Jose's comments are spot on. I would say that the top line finding, which will get a lot of attention, that over half of people in the US are economically insecure, is both striking and really not entirely surprising, because we do know some other things with some other measures, but also some policies that this sort of aligns with. What I mean by that is there is other research showing that families struggle to make ends meet, and certainly when you think about lacking emergency savings, you see that in the survey of consumer finance by the Federal Reserve. And when we talk about struggling to make ends meet, this measure makes an important contribution by including health coverage. Well, we actually have 2 different health coverage programs, in a sense, that go not quite up to these levels that we're talking about, but pretty close. So what I mean by that is we've got both the Children's Health Insurance Program, which in some states that are generally sort of higher cost, but also higher income states, you can offer subsidies and coverage close to the levels we're talking about, and the Affordable Care Act premium subsidies, right? So policymakers have acknowledged that, in fact, up to 400% of the federal poverty line, which is lower than the threshold that Jose was talking about, but nevertheless, sort of starts approaching it, should be eligible for subsidies. And I hope that in some ways this this measure helps us sort of think harder about exactly where we sort of face things out and draw some lines. Even food insecurity is heavily concentrated among folks with relatively low incomes, but we do see it go up the income spectrum a bit. I mean, if you think about it, if you're at 300% of the poverty line, 400%, and your family making $70,000, $80,000 a year, and somebody loses their job, we have a fairly weak system of supporting you in those moments. And the first thing you're going to do is not sell your car, which you need, but you might cut back on your food. So we do have some indications that don't make me think this is completely off. Let me just say ultimately that I think the report does provide a crucial contribution to our understanding more broadly of economic insecurity and hardship, as Jose said. And we can talk a little about some of the specific decisions and choices, but the core finding that our sort of traditional poverty measures even are more are sort of improved ones that Jose and I have helped contribute to, vastly underestimate economic hardship, is surely sound, and is crucial for informing policy.
Thank you for that. And I know I said I'm gonna switch over to Sadia, if that's okay, Sadia, because I want to bring you into this conversation, and then I'll go back to Jose and ND. But Sadia, as a local policymaker in a very large city, you see people grappling with getting by and getting ahead, if you will. And how well do the costs and resources described in this report align with the experiences of New Yorkers? Would love to hear you talk about that.
Sure, happy to jump in here. And I also want to just echo my congratulations to you all for, this really important work. I shared earlier that I lead New York City's Office of Racial Equity and Justice. But just to give some backstory, right, this is an office that emerged out of the 2022 election, where New Yorkers voted overwhelmingly to create an office and a dedicated focus on racial equity within city government. As you heard earlier in the program, right, within that same election, over 80% of New York City voters also voted for our city to establish a New York City true cost of living measure and to really measure what it costs to live in our city with dignity. So affordability is absolutely a priority for New Yorkers, and it's been a priority for this administration since day one. The research that you've shared demonstrates what we see on the ground, right? Housing, childcare in particular, being two of really important areas of cost in areas where New Yorkers feel the pinch. And so this certainly resonates with what we see and also what we've prioritized. We took early action in this administration to really focus our efforts around childcare, working hand in hand with our partners in the City Council to invest over $100 million in childcare programming in New York City and really reducing costs for New Yorkers from an average of $55 per week for subsidized programs to $5 per week. Right now, we are working to advance City of Yes for housing opportunity, which is really a once-in-a-generation plan to modernize our city zoning code and help deliver critical affordable housing. And I think, Greg made that point earlier around some of the disparities that we see within economic security, particularly by race, are also a function of what people have had access to, right? In terms of access to where they can live and where they can have educational opportunities, for instance, and the patterns of segregation that we have in our city and across the country still hold in many ways, right? And so this is a really bold plan to make sure that our city is building housing at pace with our population growth. And we're taking the pressure off our really, really, important housing supply and creating more affordable housing for New Yorkers, which is consistently one of the main areas of cost, right? And where New Yorkers really feel the pinch. And so there are many more, and certainly many more areas that are reflected in the report that resonate with what we see in New York City, but the report and the research is also showing us what we know, which is that New York City is not alone. And you also knowing that there's not a lot of difference that we're seeing between metro areas and non-metro areas, it really speaks to the point that lack of affordability is a national issue. And it really requires solutions and advocacies at all levels of government, especially when you consider that those who've been disproportionately impacted are children. We're seeing economic growth certainly in our city and in our country, but traditional economic indicators don't always get at what people are feeling and what they're experiencing day in and day out. And we know this in New York City, we have a history of tackling equity issues, focusing on poverty. We created a New York City poverty measure well over a decade ago. But what a true cost of living measure will do and will do for this city is really take that work further, right? And move us beyond measuring who's in or who's out of poverty based on a defined standard, towards really determining what it costs to live in our city with dignity. I would say Jose's point earlier around like there's an ecosystem of measures, right? And I think what's exciting about this work is the focus on economic security. Many of our traditional measures, particularly the federal poverty measure, are really focused on acute need. And we know that if you just because you're not at the federal poverty, or you could be above the federal poverty measure, right, and still certainly struggling to get by. And so, changing the premise and really revisiting what we even evaluate, right, what we use to measure, I think then starts to root us more in resiliency, in security, and in thriving. And so, we're excited about this work. We're excited to learn from this work as we, work on New York City's measure. And we certainly see between the types of populations that you've profiled, as well as the cost drivers that you've outlined. It certainly aligns and resonates with what we see here in our city.
Thank you, Cydia. And you mentioned childcare and housing, and Indy, you mentioned healthcare. And I'm going to ask Jose and Indy, I'm going to go back to you two. The report considers an extensive set of costs that families incur, and I just named a few, but curious to hear from you if there are other important costs that should be included, and are there costs that should be taken out? Curious about that too. And then would you revisit the conceptual thresholds used in the report for economic security? So I'm asking you to pick apart this whole measure here. Do we have all the right measures, or should some be taken out? And Jose and Andy.
I'll jump in real quick. But before I do that, because picking apart the measure, I'm always happy to do that and jump into the measurement aspect. But in doing that, I also want to situate that in that even if we were to pick apart this measure and change certain things, and even compare it to the 7 other measures that we talked about today, I think the real important part, ultimately, that North Star that we should really be focusing on is highlighting who the true disadvantaged groups are, because consistently they end up being the same, which is one of the things that we're not really highlighting right now, is that the racial demographics, the breakdown, the age, the single mothers who have children and they don't have access to other social networks, they are consistently the ones that are coming up in any measure as being disadvantaged. So just highlighting that part, that I love to pull apart measures, but there's still a focus on what do they tell us. That being said, one of the difficult parts, and I think Greg alluded to it at the end, is when we start talking about assets. I will highlight that there is that measure, ALICE, the assets, let me get it right, asset limited, income constrained, employed. It's a measure that's very similar in spirit. But when we start talking about assets, and we grappled about this on the NAS panel for the updated poverty measures, there is this inherent, this implicit rental income that's coming back our way, right? When we own a house outright, and how do we value that? And the thing about including assets in the measure is that now we have to start dealing with that conceptually all the way down the line. An easier example would be thinking about the debt loans that people are paying off. If you open up that door to debt, and it's saying, well, only education debt is what we're going to include here, then the question becomes, well, what about credit card debt? Because ultimately what we're doing is saying, this is cash that either people have on hand, access to cash, or a payment that they have to make, a minimum payment that they have to make to a credit card. So student loans fit that mold, but it also opens the door to other things. And so I'm not necessarily saying that you have to exclude it. What it does beg is the question of, well, have we thought about what is the necessary amount that you need to have? And when you get into that necessary amount, Greg mentioned 10% for example, for savings, you start opening the doors like, well, 10%, what is that rooted in? Well, that's half of the 20% that people typically give you. And then you really start going down the line of like, well, how defensible is that number? And so what I'm cautioning against is when you make decisions that open up the door to many things, then you're going to have to deal with these other criteria, these other criticisms of like, well, is that defensible? My answer to all that is actually, two things. One, if you make the measure available widely for public use, and by that I mean the actual underlying data, and you let people play with these levels, you get away from that criticism by saying we tested it at 12%, at 15%, at 20%. Even when you do that, the underlying story, which is back to my main point, does not change. So many times we're going to grapple with how close and how many things to put in there, but ultimately the underlying story doesn't really change. Finally, the most wonky thing I'll say is that because we use a consumer, if that wasn't wonky already, because we use a consumer expenditure survey for a lot of things, we are capturing the entire expenditure of families. What we're doing, though, is saying what should explicitly come out and be included in the cost, as opposed to what is typically a catch-all measure. So in the poverty rate, you typically have, let's do the consumer expenditure, median expenditure, and you multiply it by a little bit to account for all these other things that we aren't counting. So the real question here is, what costs are we not explicitly counting that should be included in an explicit way in these costs?
That was plenty wonky, but very helpful. Indeed.
Yeah, let me probe a little bit. I think that on the cost side, the report takes a pretty comprehensive approach. And that said, there could be some other costs worth considering, or making more transparent. So for example, education expenses beyond post-secondary education, such as K through 12, sort of cost for supplies, activities, may appear in the miscellaneous category. There's kind of a lot going on in that category, which is not uncommon for these measures, but that may be something that we want to make more explicit. Costs potentially related to caring for elderly or disabled family members. Some of these may be one time, but some of these may be more ongoing. And we generally see that people with disabilities have worse sort of outcomes, more hardship, like higher food insecurity, higher poverty, et cetera. And so that's, a category separate from the sort of elderly, where Greg showed that in general they tend to have more resources than their costs. But there's overlap, of course, and just as racial groups have diversity, so do age groups. The other one that sort of stood out as missing, I think Jose is right about pointing out how we may have to deal with people who sort of own their own home outright, but also we don't see in this measure home maintenance and repair costs for homeowners. It's implied for renters, but not for homeowners. Some of those are actually sort of truly essential, mandatory, not all that discretionary, where you pay one way or another, right? So I would note that. I think the other areas that sort of stand out, and some of the challenges here, data limitations, but fair market rents, it's a totally reasonable measure for folks who work on housing, though in some higher cost or desirable neighborhoods within an area covered by a sort of set of fair market rents, it's too low, that threshold, arguably. Student loan debt service, the vast majority of those dollars are owed by folks who are up to the age of 45. That's how the dollars are attributed here. But we've increasingly seen older folks with student debt outstanding. It's not dischargeable, in bankruptcies, as folks may know. And I'll say one very important, I think, positive aspect of this measure for me is advancing this idea that we all need enough resources to afford health coverage. Now, some of that depends on the fact that we have a somewhat sort of functioning, I'm not saying desirable or optimal, but somewhat functioning health insurance market where many people can buy health coverage if it's not provided by their employer or by the government directly. We don't know if we're going to still live in that world, unfortunately, in the coming years. But since the Affordable Care Act was enacted, it has given us some confidence here that with enough resources, people can sort of access health coverage, even in states that have sort of fallen short of expanding Medicaid. That doesn't mean in reality that it's truly affordable for them, but they can literally buy it. They just may not have resources and reasonably say it's more important for them to spend money on food. I mean, these are very tough choices that those very low income level and frankly impossible choices, but we can't even assume that in some cases sort of going forward. I will say this is really consequential for our understanding of the geography of hardship. So Texas, which people may think of as a low cost place to live, doesn't look so great when you account for their enormous share of the population that is underinsured and uninsured. And as was already presented by Greg earlier, in fact, there are some modest differences in the metro areas where people sort of doing better versus others where they're doing worse in cost, but it's mostly driven by income. That's quite important for us to even think about, because families often make decisions primarily thinking about what is a lower cost place to live. Not all, but some do. And it may turn out that actually leads them to more hardship, but it's wasn't necessarily obvious in considering the decision.
I love that the hardship of our geography of hardship is a really important way to think about this. I'm going to come back to you to think about resources that you might want to also consider including here. But before I do that, I'm going to come back to Sadia. And Sadia, you spoke a little bit about some policy changes that have happened, but I would love it if you could tell us how you, as a local policymaker, might use the true cost of economic security measure to shape policies and practices. We really, at Urban, we really want to make sure that all the incredible work we do is useful to folks like yourself. And so I'd love to hear how you're thinking of using that.
Sure. I think this measure and the research that's been provided really helps validate, right, where we're focused and what we're doing, and also can help us constantly evolve, right, and revisit our approach. Healthcare is a priority in New York City as well, right? Certainly another cost driver. We enjoy a localized guarantee healthcare program in New York City, NYC Cares. This administration has worked to relieve medical debt for over 500,000 New Yorkers. We have a strong public hospital system. There's a strong social safety net in New York City, and that's crucial, right, to making sure that we are helping to control costs or bring down costs for New Yorkers. But the other side of the equation is income. And so, don't want to lose sight of that. And, I think the research is demonstrating that, there's certainly work that policymakers need to do on the cost side, but there's also lots of work that we need to do on the income side. And again, this is not unique to New York City. I think it is reflected in the data that you see nationally, where wages, right, and income is not keeping pace with the costs that people have. And so there's also been certainly a focused effort within this administration around, first and foremost, recovering from the pandemic, right, and bringing back private sector jobs that were lost, increasing that by over 300,000 new jobs, but really targeting our outreach, our recruitment, workforce development programs to communities that have experienced long-term unemployment and underemployment to make sure that all New Yorkers, right, can participate in this recovery. And so, ensuring that we're leveraging this type of information to not only think about ways in which we can continue to bring down costs for New Yorkers, but also the areas in which we need to focus our efforts to increase income and increase earnings, as well as to fill resource gaps, right, is really, really important to this work. And so there's a lot for us to dig in. I'm still reviewing the report in more detail, but I would say that it definitely resonates and aligns with many of our areas of focus. And, like I shared earlier, I think the racial disparities that are also uplifted in the report, I think it noted that, Black people were 25% higher, had a 25% higher rate of being economically insecure. I think Latinos had nearly a 30% higher rate. There are structural issues that underpin those disparities. And so while we as policymakers are certainly focused on real-time programs and policies and initiatives that are addressing the needs that we see for New Yorker, there's also structural work that we need to do, right? And how we operate within government, how we allocate our resources, how we do business, right? To really ensure that we're doing so with equity infused into that work, and that we're really focused on long-term transformative reforms that begin to get at these disparities.
Thank you for that. A minute ago, we spoke a little bit about the costs that are included in this measure. And now, as I hinted earlier, want to go to the flip side of that, which is the report considers an extensive array of resources. But did we miss any, or did we undercount any? And do you think we overstated any of these resources that are included?
Well, this is my favorite part because I get to talk about Addis, a little bit of the model. And I don't know the exact thing that happens underneath Addis. It actually, belongs to the Urban Institute, which is really exciting. So one of the more exciting things for me in reading the report was like, ooh, let's see what happens when you use Alice to correct for some of the resource underreporting, correct for the participation rates, right? One of the things that's really troublesome in the Census Bureau data with this current population survey and the American Community Survey is this assumption of full uptake of benefit participation. And that's a real issue. And Addis actually corrects for a lot of that, or if not for most of it. So what I'm getting at with the resources, I actually think that's a huge strength of this report is that it's able to use Addis to get at some of this. And I was thinking about that in the context of the Latino rate being so high relative to most other groups. And I kept on saying like, well, that is not typically what I see in many other things. You see that in SPM, but not in other ones. And reading the technical documentation in the appendix, which is where I like to live, I realized that Addis does a good job correcting for unauthorized, likely unauthorized immigrants, and which means that they're not eligible for many of the benefits that otherwise in the Census Bureau they'd come up as actually being eligible for. So to that end, I want to commend the use of Addis, but also to highlight that a lot of the things that we may be seeing may be a function of just better resource counting overall. The other thing I'll add, in the wonkiest, if that wasn't wonky again, is actually the geography of disparities. This rural, urban, and really in the data, we're stuck to the metro, non-metro definition. The report and the authors did something really exciting that I'd like to elevate here. And it's a treatment of pumas. Pumas in the public data sets we can't get for privacy reasons, for good reason, down to geographies that are less than 100,000 people in population. And that sometimes can be like give us some really wild results, right? North Dakota is like 7 pumas and like Manhattan's 9 by itself. What they did though is a weighted average that tries to take into account this changes in county level and tried to basically say, we know that that's too coarse of a geography at times, so let's make that a little bit better as much as we can. Which leads to one of the findings here is that typically in the official poverty measure, you see that rural poverty is higher. With the supplemental poverty, it gets inverted. With this measure, it goes back to the rural areas, the non-metro areas actually having slightly higher poverty rates than the metro areas, which is a rather surprising thing, right? It's 51% in non-metro, in metro, and 54% in non-metro. So getting to that point of the underlying geographic distribution of this, the whole point is that the way this team has set up the resources through Addis and thinking about the geographic changes that they have to do to adapt to pumas, I think they've gotten to a really exciting set of resources, and a clean set of resources in the way of measuring it correctly at the geographic level. The only thing I would add there is misreporting. There's a lot of literature about misreporting, especially at the tails and the lower tail of the distribution. And I think that's something to pay attention to, is saying, what do we do about misreporting of data versus the underreporting of benefit participation?
Very helpful. And I am hoping that somebody on the team can put in the chat Addis. So thank you for that plug. I don't think I've ever heard anybody outside of Urban say Addis that many times. Maybe we got up to 10 times, which is awesome. So folks, please check that out and we can give you more information there. I am going to, we have about 5 more minutes before we open it up to Q&A. And I would love to kick off this next question. This is a question for each of you, and I'll start with you, Indy. We will have a new administration in Washington come January. In fact, we will have a shift in the Senate as well. And just wondering if there are policies that address the true cost of economic security that you hope you can see from the new administration. Start there, and then maybe I'll go Sadia and then Jose. And I'm going to fix my lighting while you're speaking. It's bad. Apologies.
Let me just start with saying that there may be some policies from the new administration that lower costs, but I would be quite concerned about the consequences for quality. And one of the important aspects of the true cost of economic security in this report is there's some attention to quality. Now, some of that's baked in with how the data are used for childcare, for housing, and for healthcare. But if you see healthcare costs driven down, we have to make sure that it's not necessarily at the cost of quality. So I would be very attentive to that as we see policies coming forward. The other policies actually raise a lot of concern for me. We have seen proposals for mass deportation, which would, in addition to harming families regardless of there's immigration status and communities as well, it would just mechanically just sort of reduce the number of workers in the US, and shrinking the workforce in critical sectors like agriculture, construction, hospitality would almost certainly lead to increased costs for consumers due to higher prices for goods and services, and potentially slow economic growth and the rise in living standards that we've seen despite inflation. So that would be a challenge. And then we've seen a proposal for unprecedented import taxes or tariffs, which assuredly would increase costs for American businesses and consumers. There are estimates that it could be a couple $1,000s for a typical family a year. And those don't necessarily price in sort of retaliatory measures from other countries, which could then make it harder for us to raise our incomes because we can't export our goods and services as easily. And then I just would touch on two other big areas. We're seeing already proposals in the 2025 tax reform that would include deep cuts to Medicaid and SNAP to help pay for almost certainly tax cuts that are sort of lopsided away from the working class and middle class. And that certainly would concern me. The ability to afford food and healthcare is already a challenge for many. And this all includes the premium subsidies, which for the Affordable Care Act go quite a bit up the income spectrum. And then finally, I'd be very concerned about a potential revival of the old sort of public charge rule, which essentially penalized immigrants if they used public benefits and later wanted status in the US and pursued citizenship in particular, but also a green card. And so that would discourage immigrant families from accessing needed healthcare and nutrition assistance, obviously sort of raising their costs in a sense, whether financially or otherwise, and potentially undermine outcomes. So those are just some of the areas that I'm keeping my eyes on.
I appreciate that, and I encourage folks to stay tuned to Urban, and we have a lot of materials on basically every single policy that you just listed, and the evidence and data behind their effects on families and individuals in this country. So thank you for sharing that, Indy. Sadia, I'll go to you, and then I'll wrap up with Jose before I open up to the Q&A section.
Sure. Well, that was very comprehensive, so I'm not sure where to add. But I will say, New York, right? We've always been a place that is welcoming to immigrants. We've always been a place that ensures the protection of reproductive health and reproductive justice. And this is a city where there's a strong social safety net. And so we're committed to making sure that that remains, right? Not only because this is what we value, but it's also crucial to our economy. And I think it reflects many of, much of what we discussed today in terms of the things that drive costs for families in New York. And so, the federal government obviously plays a major role in what happens in cities. Federal funding is crucial to New York City's budget. It impacts housing, it impacts healthcare, it impacts infrastructure, which are all bipartisan issues, right? And so I think, the priority here certainly is focusing on working constructively with the federal government so that we can ensure that we're advocating and getting the resources that New Yorkers deserve.
Thank you for that. And, I think one thing that's interesting about what we've seen here is the spread that the true cost of economic security is something that is an issue across the country and regardless of, how a district voted. So really important to bring that into the conversation. Jose, final words there.
I'll keep it succinct. Without getting into too many policy discussions, I'd say that housing and the supply of affordable housing, if there's an affinity for real estate and the ability to increase the supply of affordable housing, that is a policy lever that would be at least something that would be, given this report, helping us drive down the costs. And I'll leave it at that.
Wonderful. Well, thank you. And you guys aren't off the hook, so you please we get to hear more from you. I am going to welcome my colleague Greg back, who can join and would love to really open it up to folks. And I see 48 questions here in the chat, so I may not encourage you to add more, but I will start with this first one that I have here, which is, can you discuss a bit more about how the TCES, so the true cost of economic security measure, builds on other cost of living measures like United Way's ALICE, which Jose, you mentioned earlier, the University of Washington's self-sufficiency standard, Economic Policy Institute, all of the different ways, different measures that are out there. I also saw MIT's as another measure that people wanted to hear about how we can differentiate between them. So Greg, I can open it up to you perhaps to answer that question.
Sure, thanks. Again, we began the process by looking at poverty measurement, the supplemental poverty measure, the proposed principal poverty measure, and self-sufficiency standards put out by University of Washington, MIT's Living Wage Calculator, ALICE, COLI, and our internal product was a memo on what costs are captured and how they are captured. And then we kind of went through and picked and chose, and we like the way Alice does this, and we like the way MIT does that, and we like the way University of Washington does this, and no one does this quite the way we would want to. So I'm not going to sort of tick out every subtle difference across all the measures. For example, just a lot of the MIT measures are based on what people are expending in the consumer expenditure survey, as opposed to sort of identifying how much we think people need to be spending. It's what a certain group of people are spending. In ALICE, one difference that's top of mind was they look at food costs using the thrifty food plan, I believe, which is what we use for the official poverty measure. We wanted to go somewhat higher, so we went to the low cost food plan. But again, there is a lot of great work in this space, and we're happy to join that ecosystem to build up our goal, not a self-sufficiency standard or a poverty standard, but that threshold to be poised to thrive. You're meeting your bills, you're saving, you're ready to go. And again, some of this is subjective. We just want to be clear what we did and why we did it. But we think we fit in and build on the work of others. And then we also had the opportunity to take the work out and share it with people who have been moving out of poverty and establishing themselves in our lived experience panel seat. Yeah, do these costs make sense to you? Does this resonate with you? And one of the responses in that that really stood out to me was, I got a good job, I got a place to live, and I still don't feel like I'm making it, and I see it here in these numbers. I'm paraphrasing. So again, a lot of great work out there, and we built on it.
Greg, I just want to underscore something you mentioned there at the end that I think is really important, and why I just am so proud of working at Urban is that we take this data and evidence and we make sure that it is informed by people who have lived experience with the issues, with the policies that we're thinking of. So, and we're analyzing. So I really want to call out the team who made sure that we heard from folks and really informed this. So it is something that people who we are hoping will benefit from an better understanding of these policies will actually recognize in themselves. So I just want to call that out. So thank you for that. I'm not sure if anybody else wants to respond, but I have another question teed up. If not, seeing none, I will go on to the next question here. So how are senior care and caregiving costs factored into the TCES? And you spoke about this a little bit earlier. I can't remember who it was, but are there other costs associated with elder care and disabilities or other healthcare conditions that could be factored into the TCS? And I think maybe Indy or Jose, you mentioned that is something that you wish we had seen more of. So Greg, if you want to speak to that, great to hear from you.
So those costs are not explicitly factored in. Insofar as our healthcare costs are higher for elderly, for folks over 65, increase with age. But that's, again, most of those costs are offset by what we consider the value of Medicare. I think that the specific costs associated with caregiving not to children is something that we did not do and that we could consider doing in new work going forward. And I really appreciate the question, and that also that Indy had surfaced that. The other thing we can do, however, as we get deeper into the data that we have and analyze it, is we can look at costs versus resources for families in which someone has a work limiting disability, for example, because we know that in the data, and we can see that their costs look the same because we didn't do anything special, but their resources look very different. And if we think we're underestimating those costs, it's even a bigger problem than we have. So it'd be supplemental work we could do with our data. But I would love to hear from Indy if he has thoughts on better capturing the costs of care for families with people who have some level of disability.
Yeah, thanks, Greg. I would, first of all, I appreciate that response. And it's not that there's another measure out there that's doing this well. So I think we have to acknowledge that this would be, sort of a novel, but I think long overdue sort of approach as we grapple with an aging population. And just so folks know, typically your chance of having a sort of limiting disability doubles from the age of 40 to 50, and then again going from the age of 50 to 60. So it's not just about being a senior or elderly. Some of these costs will be captured in the medical out-of-pocket expenses. To some extent, you could differentiate potentially folks who have work limiting disability. Probably a bigger driver of insecurity is going to be lower resources, which I think Greg was sort of touching on there, meaning you're not able to work as much or at all in some cases. But there can be some non-medical out-of-pocket costs, including home modifications. For example, in my own home, we need a stair lift for my elderly parents who live with us. That wouldn't really show up necessarily. It's not typically it's not reimbursed by health coverage in general, including Medicare by and large. And so some of this could also be really an issue of just getting better data and then figuring out what to do with that. But just the fact that we see, even sometimes with comparable income, we see sort of more hardship with folks among folks with disabilities, that suggests something is going on the cost side as well. Transportation maybe is part of the driver as well.
And as somebody who used to think about this a lot in a former role, we also know that families who are may not have an elder loved one living at home with them, but they often still spend the the resources of caring for their children and caring for their elderly loved ones who might live somewhere else is certainly something that folks cost that we all incur or some people incur as well. So wanted to add that. Anyone else want to chime in? I have other questions. If not,
I just
Jose.
add one small thing, Greg, that the data in the ACS is actually, and your report does a really good job highlighting the different sort of families, at least bucketing these families. And there are variables in the ACS that let you at least try to identify the independent trouble with walking, trouble with hearing, etc., when you find these complicated living conditions. And I think that's something to exploit.
So what do you see, and I'll open this up to anybody here, what do you see as potential solutions for closing the gap between families' costs and resources? And Sadia, you spoke about this a little bit. We've all touched on housing, but just people have thoughts on potential solutions for narrowing that gap. Anyone can respond.
Sure, I can jump in. I mean, I think I shared some of the ways we're trying to tackle this in New York City, through policy interventions. I would just emphasize the importance of housing again, because housing not only is a cost driver, right, but it's core to all the other areas of stability that people need, right? Whether it's educational attainment, being able to maintain employment, it impacts recidivism, it impacts your health outcomes. And so it's very central not only to a family budget, but it's also very essential to stability and stability for a city. Um, I would also just emphasize that, while there are solutions on the cost side, as I shared earlier, right, the other side of the equation is income and ways in which we as government can also fill resource gaps, whether that's benefits, whether those are tax credits, whether there are other ways in which we're getting money into people's pocket, in addition to helping them increase their earnings so that we can start to bring down those gaps. I think this information is also important for the private sector, right? It's important for employers and for other actors to also think about the ways in which the way in which we're compensating employees, the conditions that we're creating in the workforce, right? How that may be impacting the stability not only of families, but right, our workforce overall.
Indy, I saw you go off mute. Did you have something to add or?
Sure. I was going to say that I think everyone is right to focus on housing. It's just the biggest cost in folks' budgets, especially when you have a low, moderate, and even middle income. At least it's a single biggest kind of line item. I think, of course, there's things, whatever happens at the federal level, that the state and local governments can do, including on housing, as Sadia was mentioning. But I think we should think about state level health coverage programs as well. And sometimes there are options within federal programs like SNAP, where they can sort of expand things more. And partly because Sadia just brought up the role of the private sector, one of the things that one can do with limited to no fiscal impact is potentially revisiting some minimum wages. Sometimes they're especially low for tipped workers. So I would just note that. And there are obviously state and local earned income tax credits that can be helpful on the resource side. So there are a number of policy options, regardless of what happens at the federal level.
Okay. Greg, I see you, so please chime in.
And I wouldn't want to lose sight of healthcare costs because they are a large cost item. And so, to the extent that people have access to health insurance, if not through their employer, then through an ACA exchange with subsidies that have been expanded and are set to contract in 2026, that is a cost item that's fairly large. And if you don't have health insurance, that's a big cost without any offset.
Sadia, please.
Oh, go
Or
ahead.
Jose and then Sadia. Nope, Jose, or go ahead. I'll let you guys figure it out.
Go, Jose.
Sadia.
All right, I'll jump in.
It's my job, actually. I'm going to call on you, Sadia.
Just to close out, I mean, one other point that I would just add is, looking again at like structural issues that contribute to what we see, pay equity being one of those, right? So if we know that women and people of color, right, are not being paid comparably to their white male counterparts, right? All of our efforts, whether we're driving down costs or connecting people to opportunities, are still not maximized because people aren't getting paid fairly. And so I think that ensuring that we're meeting the immediate needs, but still really focus on the structural issues at play that are really demonstrated across the different data sets and the household types and the different demographic groups that were shared is important, because we won't really be able to see that gap close.
And I'll jump in with thinking about time horizons, right? As Greg mentioned, this is a point in time estimate. And when I do think about the CTC, we talk about the child tax credits, the EITC, we're thinking about that huge effect, right? We see that research coming out of Columbia about just how much the child poverty rate dropped. But this measure is about thriving. And that got me thinking about like what we're really trying to get at is what are these long-term policies that are going to help people stay for a longer time in that position of thriving, which makes me think about, actually, I'm going to plug another one of your tools, a social genome model, about thinking about what is actually working in the long term to get people to that position of thriving, as opposed to just giving you enough to get past a line here for a little bit, as opposed to giving you enough to thrive at a much higher standard.
I promise Jose he's not on the payroll, but it's so heartening to hear you say this, and I hope others who are listening are as familiar with our resources as Jose, because they truly are remarkable. So I'm glad to hear you say that. You mentioned this 2022, or just kind of point in time, and Greg, I'm curious if you're another audience member is curious if you intend to update it. You mentioned hoping to update this, and then would you look back at years prior to 2022 if in addition to updating?
We are definitely interested in establishing this as a regular measure. And so we are hoping that there's enough appetite for it that someone will provide funding to Urban to do it. And that was a shameless plug. And then going backwards, some of the data sources we use are not necessarily going to be available in the same form. So we've talked about sort of trying to get an earlier benchmark, but that might be a little trickier. But we definitely are interested in establishing this measure, seeing it going forward, and then also unpacking the measure a bit more. Why do we see high rates of economic insecurity among Hispanic people? They live in the West region. Is that, and in the non-metro West in higher proportions? Is that the factor that's driving it, or is the Western region higher in economic insecurity because Hispanic people live there? How much of it is, what are the factors underlying the summary statistics that we're able to generate? So that's also something we would like to do. And then also seeing what different, what if scenarios, what policy changes can we see, and how that will affect how many folks are economically secure in different situations. So lots of aspiration.
And just thinking about what you said there, wanting to understand this about Latino populations, I would also just bring in what Sadia said, and are there inequitable policies that make it such that Latinos are earning less, and therefore there is that's why you're seeing those discrepancies there. I want to ask more questions, but I am going to follow the rules here and just thank everyone. We have 2 minutes left, and just really appreciate this rich conversation and the expertise. And congratulations, Greg, and everyone on the team who has put this together. It truly is quite an advancement for folks who think about this. And I would want to encourage two things. One, if everybody could answer the survey, we have, it takes 1 to 2 minutes, and it is very helpful to us here to make sure that we're providing high quality programming for you all. And then we will pull a log of all the Q&A, all the questions, and then we will follow up with responses to the questions. So I just want to say thank you to everyone, and we hope to continue this work and continue learning from you all. So thank you, and be well.